From the podcaster. Powered by Timber Media.
On the show today, we have Dr. Manohar KN, who's consultant physician and diabetologist at Manipal Hospitals. Now, some of the symptoms, doctor, of COVID-19, if you could help us understand those, what should we be watching out for?
Yeah. We'll take it in two parts. One is first for us to understand what is incubation period.
Okay.
And second is symptoms.
Right.
For example, someone comes in contact with a person who has COVID infection and he is in contact and he will not show the symptom immediately.
Right.
The symptoms start appearing anytime between 3 to 14 days.
Okay.
So this is the time period in which the virus stays in our body, multiplies to an extent where it forms a very strong organism and start affecting the organs which manifest as symptoms.
Right.
Sometimes when you're asymptomatic period now, the incubation period, you can still be infective to the others. So why is this important to know? This is where that term quarantine starts working well, and we should isolate these people for that period up to 14 days.
Right.
So this is incubation period. So now what are the symptoms? The symptoms, most importantly, what we should understand is it's impossible to differentiate coronaviral symptoms from common cold symptoms.
Yes.
So all of us have experienced common cold. We usually have a fever, cold, cough, sometimes diarrhea, which lasts 3 to 7 days. 7th, 8th day, we more or less every time we recover and we are good to go back to work.
Right.
But in coronaviral infection, 80 to 90% still will recover in 7-8 days.
Right.
But a few subset of people whose possible immunity is not good or whatever mechanism or the viral load is too much, they may succumb to complications. More importantly, the respiratory complications. They will have atypical pneumonia, we call it as, which can progress to multi-organ failure. So that is where the problems are, and that is how we clinically have to differentiate between common cold and coronavirus is the high rate of complications which we see in coronaviral infection.
So in the event that someone has a cold or flu, because right now I think alarm bells are sounding and we can't be careful enough. So doctor, what would you advise people to do? Should they rush? What is your opinion on that? To see a doctor, or should they isolate themselves? What is the course?
Yeah, we are seeing a lot of panicking by the people, which is expected with so much of media, social media. Everyone gets information and they incorrectly interpret it. For example, you are seeing like Spain had a lot of deaths today, 600 odd deaths. China had so many deaths. India had 3-4 deaths. Please understand that it is not that everyone who had the disease are dying.
Right.
Even the statistics says 90 to 98% of the people, depending on the other risk factor associated, will still recover completely without doing much. So when should you get worried? If someone has cold and cough, I keep telling, and we have been messaging all our patients, if someone has simple cold and cough, please don't try to come and visit the doctor also. Please stay at home and please stay put. Try to isolate yourself from others and watch for if you're unusually tired or unusually breathless. If these two things are there, rush to the emergency or rush to the medical care facility. Otherwise, routine, I'm seeing a lot of cases. Naturally, people are anxious. I don't have any symptom. I just want to get it tested for COVID. Please do it. I have only headache or I have only fever. I'm worried. Naturally, all of us are worried. But this anxiety will cause more problems. You may have a higher risk of contracting the disease if you try to come and visit unnecessarily. So calm down. If you have these symptoms, isolate yourself, but keep an eye. Watch if the symptoms are not improving, then only we'll go ahead and get it tested and treated aggressively. Otherwise, the treatment would remain the same. How you manage a simple cold and cough with paracetamol, citrazine, hydration, rest, that should be it.
From the podcaster. Powered by Timber Media.